Our hospital was built in 1949, and the way that we deliver medicine today is very different than it was in 1949. We needed to adapt the environment to the way that medicine's provided in today's setting. Our previous OR, we had many rooms that were different shapes and sizes. So for staff, where things were, how they were located was not natural flow. What our goal was is to get 6 homogeneous rooms.
It involved us having to come up with the ability for them to maintain their existing ORs while we constructed new ORs literally on the other side of a wall.
The complexity of running an OR while construction is going on the other side is, it really can't be appreciated. We were living right in it. I mean, so we had construction going on literally next door, right the other side of the wall.
How are we going to keep other patients safe? There's no other place that is more risky to work in than in an OR area, an occupied, ongoing OR area. I mean, those people are in there, they're already sick, they're already compromised, and any little thing that you add to that could have really, bad effects for them.
We have to maintain a sterile field. We can't have dust dropping in. We can't have the walls vibrating.
So we actually went through and built a new drywall partition. We caulk everything, and then we actually taped all the joints. It's similar to what you do right before you paint a wall. Now we got to make the area negative to make sure we're not pushing anything, we're actually sucking everything in so nothing could migrate out.
It was obvious that this wasn't the first hospital construction project they've worked on. The project was on schedule. Actually, I think it was a little bit ahead of schedule, and it was certainly on budget. It was kind of a sad day when they left because our staff, they were so used to seeing them around, they didn't know if they were their employees or our employees. So
the trust that they put in us to work in this area and for us to walk away, a year later and say, wow, we did this, we didn't have any issues, we never compromised the patient, we kept the staff and we kept the facility up and running as we promised. That's where I think you really see that you understand healthcare and you can build in a healthcare environment.